contractions that are going on. But when we have a deglutative inhibition, it's so that we continue to stretch the esophagus until it can't, and then we relax it, and then it goes into our stomach. It's detected in our throat, and it's a contrast to peristaltic contractions. And we do this to prevent the secondary peristalsis from happening, so we don't have to keep on contracting and contracting until the food comes out. We just keep on stretching the esophagus, fit as much, and then we push it down. So the sensory information for the deglutative inhibition comes from the throat. It goes to the brainstem swelling center, and then the output is to the esophagus, which causes relaxation of our esophagus, allowing it to continue to stretch so it can hold more food. Now, this is involving the extrinsic neurons. It's not sympathetic. It is parasympathetic, which is counterintuitive, because when we talk about parasympathetic, we're thinking in our GI tract we're contracting, but here it has been known that it's not contracting, it's relaxing, but it's driven by parasympathetic nervous system. And so the control of our esophagus is by so the control of our esophagus is the parasympathetic nervous system. So it's output from the brain system swelling center, and when they've done vagotomies, they've seen that it inhibits only the lower 1/3 portion of the esophagus. They haven't seen the middle or the upper. Perhaps because the lower 1/3 is our smooth muscle, but it's not positive yet. And also we have the intrinsic neurons. This is also still, there's not enough data on it, so we're not sure. And other than the control, we have the stimuli within our esophagus. So a stimuli is, the first one is stretch in the wall of our esophagus. As tension increases, force also increases within the esophagus. Force is in the contractions. And also, it's interesting that the temperature of the bolus has an effect on the force as well. So as temperature increases, the force also increases. So now we've gone through the esophagus, and we kind of talked about the lower esophageal sphincter. We said that it had low pressure and it prevents reflex, and also it's not contracted 100% of the time, hence the fact that it has low pressure, unlike the sphincter, the upper esophageal sphincter, which had the high pressure and mostly remains contracted until stimulated. An important thing about the lower esophageal sphincter is we have this thing called the transient LES, lower esophageal sphincter relaxation. It's temporarily, so it is if the TLESR frequency increases, then you're at risk of esophageal erosions, which is reflex from stomachs. So if we're having a lot of these, usually when we have these, it's the purpose is for burping, just getting gas out. But if we have these too much, then we get these esophageal erosions, and then if there's significant damage, then we get esophageal ulceration, which is really bad because it leads to esophageal cancers. That's not fun at all. The things that increase our chances of getting the frequency of increasing of the TLESR are when we have increase in body weight, tight clothing, even when your belt is too tight, pregnancy, and when patients who have alcohol, coffee, caffeine, chocolate. It's not for sure what causes the TLESR, but we know through seeing patients there's been a trend in seeing these four things. So I put down all the some of the causes, the possible causes of an increase in the frequency of the TLESR. Now, so we have these arousins, and this becomes a disease when we have all the chronic state of esophageal arousins from the frequency increasing and the relaxation of our lower esophageal sphincter. And we call this GERD, G-E. So we have the GERD, which, as I said, it's once we have a chronic state of these arousins, which we see here from the frequency increasing, we get the GERD disease, which stands for gastroesophageal reflux disease. And the dangers of GERD are oral ulcerations, tooth decay, increase in esophageal cancers, and that's because we have acid coming back into our mouth and through our esophagus. And sometimes this is called flame tongues of erosions in esophagus. So if you take a scope down to the esophagus, you see they call it flame tongues. So you see these red inflammations. And treatments for it are to stop eating certain foods like the alcohol, coffee, chocolate, stay up when eating, sitting up, never lie down, because the acid might, since you already have a weak sphincter, it's going to come back up. There's also, you can take Pepto-Bismol, Rolaids, which are the cheaper version, but doctors give the protein and peptide inhibitors and histamine receptors as well, the antacids. There's also, we have dysmotilities and swallowing disorders, where there's damage to the brainstem swallowing center and food starts to go to our respiratory pathways. It cannot get blocked because we lose the peristalsis of our lower 1/3 sphincter of the smooth muscle. And it can also go to our stomach, our small intestine, and large intestine as well. We lose the lower sphincter, esophageal sphincter tone. So we have reflux, and then there's GERD. We have the reflux diseases. We have some specific ones we are going to talk about. So one of the ones we have is scleroderma. Basically, the immune system attacks its own tissues, the epithelium tissues and the epithelium cells, as well as the muscle cells. Usually these patients have tight skin and they lose peristalsis of their lower esophageal sphincter. They have reflux, and then there's the GERD. And then we have achalasia. There's different types of achalasia. We have the idiopathic, which means that it's of unknown causes. We're not sure exactly where it's getting it from. And then we also have one which is really bad. It's the assassin bug that transmits these neurotoxin that knock out the intrinsic neurons and organs. It's known as Chagas disease. Um, it's the bug is called the trypanosome crazy. Um, and yeah, you don't want to be messing around with those. So that is all we have with the swallowing reflex. Next, we're going to be talking about the stomach. So watch the next video for that.